Hello and welcome to Book Central Inside the Pages, where we dive deep into the stories that shape our lives, our culture, and our understanding of the world. I'm your host, Abbie Morgan, and today we're stepping away from the pages for a moment to explore a topic that resonates deeply with many of the stories we cover, especially in military fiction. We're talking about PTSD, specifically military PTSD. And who better to guide us through this complex and critical subject than Dr. Tony Shaw, a leading psychiatrist and expert in military PTSD. Dr. Shaw, thank you so much for joining us today.
Thank you for having me, Abbie. It's a pleasure to be here and to talk about such an important topic.
So, PTSD, or post-traumatic stress disorder, is something we hear a lot about in the context of military experiences. But for those who may not be familiar, can you start by explaining what PTSD actually is?
Certainly. PTSD is a mental health condition that's triggered by experiencing or witnessing a traumatic event. This could be anything from a natural disaster to a serious accident, terrorist act, war combat, or even a violent personal assault. For those in the military, PTSD often arises from experiences in combat or other service-related trauma. The symptoms can include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. It's more than just a bad memory, it's an ongoing psychological struggle that can severely impact a person's day-to-day life.
It's fascinating and terrifying how an experience can leave such a lasting impact on someone's mental health. What are some of the specific symptoms someone with military PTSD might experience?
Military PTSD can manifest in several ways. The most common symptoms include reliving the traumatic event through flashbacks or nightmares, which can be incredibly vivid and distressing. There's also avoidance. People might avoid places, activities, or even thoughts that remind them of the trauma. You also see negative changes in thinking and mood. This might involve feelings of hopelessness, memory problems, difficulty maintaining close relationships, or feeling detached from family and friends. Another key aspect is hyperarousal. This is where the individual is constantly on edge, easily startled, and may have difficulty sleeping or concentrating. They might also engage in self-destructive behavior, such as drinking too much or driving recklessly.
That sounds incredibly difficult to live with. How does military PTSD differ from civilian PTSD? Are the symptoms the same, or are there differences?
The symptoms of PTSD can be similar regardless of the cause, but military PTSD often has a unique set of triggers and challenges. For military personnel, the trauma is frequently related to life-threatening combat situations, the loss of comrades, or other experiences that are hard to translate into civilian life. There's also often a culture of stoicism in the military that can make it difficult for service members to seek help or even acknowledge their struggles. In contrast, civilian PTSD might result from events like car accidents, natural disasters, or personal assaults. Traumatic, certainly, but different in context. The nature of military service, where individuals are trained for and often exposed to repeated traumatic events, can lead to a more complex form of PTSD. This is where we start to see the lines between normal PTSD and what we call complex PTSD, or CPTSD.
I'm glad you mentioned complex PTSD. I've heard it talked about more and more recently. Can you explain what it is and how it differs from regular PTSD?
Absolutely. Complex PTSD, or CPTSD, is a condition that arises from prolonged or repeated trauma, particularly in situations where the individual feels trapped. This is common in cases of childhood abuse, domestic violence, or, in the case of military personnel, repeated exposure to combat. CPTSD includes all the symptoms of PTSD but also adds layers of additional symptoms, such as emotional regulation issues, difficulties with self-perception, and challenges in relationships with others. For example, someone with CPTSD might struggle with intense feelings of shame, guilt, or worthlessness, and they might have a distorted perception of their abuser or the situation, sometimes even to the point of defending or rationalizing it. They might also have trouble managing their emotions, experiencing sudden outbursts of anger, depression, or even numbness. Relationships can become incredibly difficult as they may find it hard to trust others or form meaningful connections.
It sounds like CPTSD is even more challenging to manage. What does living with PTSD or CPTSD look like for someone, especially a veteran?
Living with PTSD or CPTSD can be a daily battle. Veterans with these conditions might struggle with flashbacks triggered by sounds, smells, or situations that remind them of their traumatic experiences. Something as simple as fireworks on the 4th of July or a loud bang can transport them back to a war zone in an instant. On top of that, there's often a feeling of alienation. Many veterans feel that people in civilian life can't understand what they've been through, which can lead to isolation and difficulty in forming or maintaining relationships. It's not uncommon for them to feel hypervigilant, always on the lookout for danger, which is exhausting both physically and mentally. In some cases, veterans may turn to substance abuse as a way of coping with their symptoms, which only exacerbates the problem. The good news is that with the right support and treatment, many can learn to manage their symptoms and lead fulfilling lives.
That brings us to the next point: coping mechanisms. What are some of the ways veterans can manage their PTSD or CPTSD?
There are several coping mechanisms and treatments available for veterans struggling with PTSD or CPTSD. One of the most effective treatments is cognitive behavioral therapy (CBT), particularly a form known as cognitive processing therapy (CAPTIN), which helps individuals challenge and change unhelpful beliefs related to the trauma. Another is prolonged exposure therapy, where the individual gradually confronts trauma-related memories, feelings, and situations they've been avoiding. Eye movement desensitization and reprocessing (EMDR) is another therapy that has shown promise, particularly for trauma. It involves using guided eye movements to help the brain process and integrate traumatic memories in a new way. For some, medication can also be helpful, particularly antidepressants, which can help control symptoms like anxiety, depression, and hyperarousal. It's important to note, though, that medication is often most effective when combined with therapy. In terms of self-help and everyday coping mechanisms, mindfulness and relaxation techniques can be incredibly beneficial. Practices like meditation, yoga, or deep breathing exercises can help individuals manage stress and reduce symptoms of hyperarousal. Staying connected with a support network, whether it's friends, family, or fellow veterans, is also crucial. Social support can provide a sense of belonging and understanding, which is vital for healing.
It's comforting to know there are so many avenues of support available. But what about for those who might not yet be ready to seek professional help? Are there self-help strategies that they can start with?
Yes, there are definitely self-help strategies that can be a good starting point. One of the most important things is establishing a routine. Structure can provide a sense of stability and normalcy, which is often disrupted by PTSD. Regular physical exercise is also highly beneficial. It not only helps to reduce stress and anxiety, but also improves sleep, which can be a major issue for those with PTSD. Grounding techniques are another useful tool. These are strategies that help keep someone in the present moment, which can be particularly helpful during a flashback or period of intense anxiety. Techniques might include focusing on physical sensations, like touching an object with a distinct texture, or doing a simple mental exercise, such as naming 5 things you can see, 4 things you can touch, and so on. Journaling can also be a powerful way to process emotions and thoughts, providing an outlet for the feelings that might be too difficult to express out loud. Some veterans find solace in creative activities, art, music, writing, which allow them to explore their emotions in a non-verbal way. Importantly, I encourage anyone dealing with PTSD to reach out, even if it's just to talk to someone they trust. Isolation can make symptoms worse, so staying connected, even in small ways, is vital.
It sounds like there are a lot of ways to begin the healing process, even before stepping into a therapist's office. But for our listeners who are friends or family of someone struggling with PTSD, what can they do to help?
Support from loved ones is absolutely crucial. First and foremost, it's important to educate yourself about PTSD. Understanding what your loved one is going through can help you offer better support. Be patient and compassionate. Healing from PTSD is a long journey, and there will be setbacks along the way. Simply being there, offering a listening ear without judgment, can make a huge difference. Encourage them to seek professional help, but don't push too hard. Sometimes, the idea of therapy can be overwhelming, and they need to come to it in their own time. In the meantime, Offer to join them in activities that might help, going for a walk, practicing relaxation techniques together, or even just spending quiet time with them. It's also important for supporters to take care of themselves. Supporting someone with PTSD can be challenging and emotionally draining, so make sure you're also seeking support and taking time for self-care.
Dr. Shaw, this has been such an enlightening conversation. Before we wrap up, is there anything else you'd like our listeners to know about military PTSD?
I'd just like to emphasize that PTSD, whether military or civilian, is not a sign of weakness. It's a human response to extreme stress, and it's okay to ask for help. The road to recovery can be long, but with the right support, it's absolutely possible to manage the symptoms and lead a fulfilling life. If you or someone you know is struggling, reach out, there's help available, and you don't have to go through it alone.
Thank you so much, Dr. Shaw, for sharing your expertise with us today. This discussion has been incredibly valuable, and I'm sure our listeners have gained a deeper understanding of what military PTSD is and how it can be managed.
Thank you, Abbie. It's been a pleasure to be here and to contribute to this important conversation.
And to our listeners, thank you for tuning in to Book Central Inside the Pages. If you or someone you know is dealing with PTSD, remember there are resources available. Reach out, seek support, and take that first step towards healing. Until next time, take care, and we'll see you inside the pages.